CataractCoach.com. Cataract surgery for a very famous actress. So make sure that you do not touch or damage the iris at all. That means no iris hooks, no pupil expansion ring, no iris stretching, no nothing like that. Don't prolapse the nucleus out of the bag either. So this patient is a very famous actress who you have seen on many shows over the last many, many years. And there are a lot of times when this patient has very close-up camera angles right on the eyes. And it's very important for this patient to have beautiful irides, or don't damage that iris tissue. That's the key. Now you can see this is the maximum dilation. I put in so many drops of tropicamide, phenylephrine 10%, you name cyclogel. I put in all the drops. And this is the maximum dilation. So what are you going to do here? Now, we did some viscomydriasis, like OSHA taught us, and the pupils probably expanded at maybe 4.5 millimeters or 5 millimeters. And you've seen my videos before. You know how much I love to just get that big rexus done, prolapse the nucleus, and wolf it down. But not in this case. So again, here's a patient where pre-op refraction is about plus 150 spherical, and we're going to aim for a monofocal IOL and a post-op goal of plano or emetropia. Now, carefully creating this rexus here, notice how the rexus is bigger than the pupil. So this patient has about a 4.5 millimeter pupil, so we're going to make about a 5 or 5.5 millimeter capsular rexus. Taking our time here, I'm showing you the entire case start to finish in real time. So that's why it looks like it's in slow motion, because it's actually real time. Now, normally I'd want to prolapse it, but I'm not going to do that. Because you have a risk. If you prolapse the nucleus out of the bag too much, what are you going to get? You're going to get the nucleus extending or stretching out that pupil. So I don't want that. So it's partially prolapsed out of the bag, but just a little bit here above the iris plane. And that's okay. So again, I do not want to damage the iris sphincter at all. If you say, oh no, I'll do a sphincterotomy, I'll put in a Maleugen ring, I'll put in iris hooks. No, that's going to damage the iris, and you don't want to do that. So here, now going with a phaco probe, I'm just going to chop this nucleus into halves. And hey, do you remember about CataractCoach.com, our teaching website? You can learn so much good information here, including our weekly podcast. Check it out. Anyway, back to our case here. Taking on the cataract pieces, you can see I don't want to prolapse the whole thing up. Yeah, partially prolapsed, kind of operating at the iris plane. Take our time to just chop and emulsify the fragments here. And in my mind, I'm kind of keeping track of, well, what's what? It looks like a jumbled mess to you, but it's very clear to me of what's going on here. So we're very carefully aspirating here, bringing the pieces up. And again, I'm showing you this case in real time to show you what is reality here. I do not want to damage the iris at all. Not for this patient. Here's another chop. And you can see we've got the nucleus basically split into smaller pieces. And we're going to emulsify them here at the iris plane. Again, not going to do anterior chamber phaco. We're not going to damage the iris. We're going to be very, very gentle here. And for all of you who said, no, I'll put a Maleugen ring, it'll be fine. You tell me, look at your Maleugen ring patients post-op and look at their iris. Can you tell a difference? Now, imagine a patient with a very pale blue-colored iris like this one, who has very close magnification done with studio lighting and very high-definition cameras. Remember, in a movie theater, when there's a close-up of this patient's face, the iris is not going to be like 11 millimeters, 12 millimeters in diameter. No. It's going to be like a couple of feet or a meter or 2 meters in diameter. So any damage to the sphincter there, any damage to the pupil margin will be clearly evident. And this is why my preferred technique in this patient is to do it just like you saw. No iris hooks, no pupil stretching, and certainly no Maleugen ring or any other type of pupil expansion ring. So those are all great devices and they have their role. But the pressure's on. I am honored. Do you know that I've done surgery? I'm so blessed. I've done surgery for probably more Academy Award nominees and winners than any other surgeon on the planet. That's the crazy part. And again, the pressure is on. The stakes are very high. So here comes the monofocal lens. And you're thinking, well, why do you put a monofocal lens in this patient? Remember, this patient, she started off plus 150 hyperope, and we're going to make her emetropic. The other part of this patient is, Remember that this is the maximum pupil dilation. This patient in normal room lighting has a 1.8 to 2 millimeter pupil. Now I'm using the chopper and checking underneath the iris, make sure the eyeball is totally in the bag, make sure there's no retained lens fragments, make sure there's no cortex still in the bag, and we're all clear. Now let's go behind the optic, remove the viscoelastic, and clean this case up. But yeah, this patient actually has 2 millimeter or smaller pupils in almost all lighting conditions that are to be experienced in normal like living during the daytime. And as a result, with this pupil here and this monofocal lens, this patient is absolutely 20/20 or 6/6 for distance, as well as like J1 or 2 for near. This patient is absolutely happy. So again, you got to tailor the surgery to the patient, and we do the exact same thing of the other eye. And before you ask me, well, what about getting a reflection off the eyeball surface? I assure you, as someone who's done more Academy Award nominees and winners than anyone else on the planet, this patient absolutely can have the studio lighting altered just a little bit by a few degrees to make sure there is no reflection. And you, I promise, have seen this patient on the big screen. Thanks for watching. Remember, check out our podcast every week. A great new episode. I promise you will learn a lot.